Today we're going to discuss your newborn. We'll talk about sleeping, feeding, and those little things your newborn does that seem worrisome but are absolutely normal. There's no need to wake a sleeping baby to feed them, especially at night. If your baby gets a good few hours of sleep, they'll wake up much more alert and be much quicker feeding than if you wake them. In general, it's best to let your baby feed as much as they need to feed. Sometimes newborn babies taking the breast will feed as often as every hour for several hours. This is something called cluster feeding. However, if your baby seems to be eating every hour all day long, you may want to talk to your pediatrician to see if there's something else going on. In general, if you're breastfeeding, it's better to feed on demand right from the very start instead of trying to put your baby on a schedule. Many people are surprised to learn that their newborn can sleep many hours without feeding right from the very beginning. Pumping often complicates matters. We all like to know exactly how much baby is getting, but when you put the baby on the breast, they often get more milk than when you try to pump.
When you come out of the hospital, oftentimes many nurses have taught you several different techniques of how to get the baby to burp, and they get these large, big belches. And then parents feel nervous when they can't do it themselves at home. Breastfed babies typically don't need to be burped, and the air will just come up on their own.
It used to be that pediatricians recommended to burp babies vigorously after each feed, and this has fallen out of fashion. Actually, it's not necessary to burp your baby after feeding. Why? Because if there's air, it's just going to come up without you banging on the baby's back. So burping will happen naturally, and there's no need to generate a burp.
In the first few weeks of life, newborns have a lot of different behaviors that you may not feel comfortable with. Gas and excessive crying, and there's no real schedule at the beginning, and sometimes that makes parents feel anxious, but that's exactly what newborn behavior is.
Newborn babies do a lot of strange little movements. They have reflexes where their arms shoot out to the side suddenly, and they also often pull their legs up to their chest and grunt and scrunch up their face. Try not to think of this as pain or discomfort. This is just your baby getting used to moving. Sometimes swaddling can help soothe your newborn in those really difficult moments. But in general, if your baby is calm and content, it's best to let their arms and legs free so they get used to that movement.
Of course, a baby loves to be feeling bundled in the first few hours of life, but very quickly they love to be able to expand and be able to use their hands and put their hands to their mouths and so on.
Now that you're not getting any sleep and constantly with your newborn, you're going to notice every little mark on their skin. And they have a million little rashes in the first month. You're going to have baby acne, dry patches, maybe even a little diaper rash. But really, those aren't going to be concerning.
Pacifiers can be very helpful in the first few weeks when your baby doesn't know how to soothe themselves. However, it's much better to try to get rid of that pacifier as quickly as you can and use it only in those moments where you really need a little help. Many people are surprised at the amount of sneezing their newborn does. They ask if it's an allergy to their cat or something else in the home. In fact, it's a reflex, and it's nature's way of helping them keep their nose clear. In the very beginning, I often tell people just to monitor wet diapers. Babies have to pee, and if they are peeing, you know they're hydrated. If you're getting at least 3 or 4 wet diapers a day, that's enough. Stop counting.
For some reason, parents are generally really concerned about their child's umbilical cord that's drying up. It's really just gross. It'll stink a little bit, it'll smell in a week, it'll usually ooze and have a little bit of a dried scab. But there's nothing you need to do for it or to touch it or to even clean it. Just leave it alone, it'll fall off.
As long as there's no redness and swelling around the site of the belly button, there's nothing to worry about. Most places in the world, a baby is born and they slap the baby on their back and off they go. Your newborn is meant to go where you go, whether that's Whole Foods or the coffee shop down the street. Just wash your hands and be smart. Your newborn's not likely to be rolling around on the floor and playing with toys with other kids, so it's absolutely fine to have your friends come over and bring their kids and have everyone around the newborn baby. Again, it's all about hand washing.
When you come in for your newborn visit, our goal is to help you understand all the unusual behaviors of newborns so that you feel comfortable at 3 in the morning as opposed to worried about something.